Our clinic uses a high-tech digital X-ray system to provide the precise diagnostic image with minimal X-ray depth.
When assessing the maxilla for suitability for implants, the first process is to create a panoramic view from the cone beam CT and the data provided. To do this, place the mouse over the green line in the sagittal section, rotate, place the mouse over the midpoint between where the yellow and green lines bisect, lift that line up so that the green line is parallel with the palette. Move it slightly further up so it's actually just on or over the palette, and you will see that the axial slice, which is the green line passing through, gives you the curve of the alveolar process in the maxilla. Now we need to turn this into a panoramic, so if you go to the toolbar at the top, there's a button which says panoramic curve. Place a single click, second box comes up saying manual, click on that again. You will notice now that all the other green lines and yellow lines have disappeared, and you have a mouse pointer with a little small white arc with some red dots around it. If you go to the back of the jaw, now in this section we're really just having a look at the right hand side of the maxilla. You make a single click and the pterygoid plate region, another single click, a single click, single click, and I'm going to finish it here. I could carry it all the way around the other side and we get a complete panoramic, but I'm just making an example of the right side and the right maxilla. So you double click to finish, and here you have a sectional view. The dark shadow here at the top is where the image has been cropped so that we don't get any orbital views. Now to clean this image up, right click whilst being over the panoramic and set the thickness to 0.5 away from the 2mm it's currently standardly set. If you click at that, you'll notice the image sharpened up. If also you go to apply filter in the toolbar on the left hand side, last box, click on apply filter and click on 2D sharpen, and that tidies the image up. Personally, I tend to work off a central image. The orange line here corresponds to the box in the sectional view above. If you double click in the box you're interested in, this orange line now is a 0.5 mm slice that you're viewing up top. You will see in the maxillary sinus that we have a septa here. You will also notice that there's reasonably well developed thickening of the lining of the sinus here, up and over this septa and then travelling posteriorly, and that's reinforced when you look at the sectional view top left hand side, where we see the outline of the floor of the sinus, and then we see this thick lining underneath. Now this is particularly useful in identifying, particularly if you only need a small amount of elevation, because in careful hands the Summers technique will work very well here, rather than actually exposing the patient to a Caldwell look type preparation. So if we place the line over the area we wish to view, which is roughly over this first molar tooth, I can scroll back and forth by scrolling with the mouse scrolling button. We see that we've got inadequate bone in this area to place an implant, but we do have a very thick sinus lining. Now if we just take some basis measurements, we go to the button at the toolbar at the top left hand side, and there's a little ruler. Click on it and click on 2D, because it's a 2D ruler you're after, and we have a quick measure to the floor of the sinus. If I hold the right button down, I can move that out the way. Click remotely and it takes the little white squares off. So we can see that from crest to base of sinus we've got about 4.3 mm. Now in this situation, if you're experienced with the Summers technique, you can prepare the site to 3.3 mm and then use an up fracture technique, allowing a biomaterial such as BioOs or osteobile or whatever your preferred material is, and that can be very carefully inserted and spilled using the Sinus technique, so you can create an indirect sinus lift. That's quite useful. The other useful bit of information here is that if you were planning on doing a Cordwell Look procedure, you'd need to be aware that this is a fairly thick buccal wall, but the other advantage you get from cone beam CT is that you can determine where you make your window, your fenestration. I'm just going to get rid of this line here, so I'm going to right click and that brings up the delete button, and then I'm going to left click and that gets rid of it. But if I was planning to do a Cordwell Look procedure, I'd want the inferior cut to be approximately 2 or 3 millimeters above the floor of the lining, so I could insert my sinus lift instruments and elevate the sinus up. And I'd want to make sure that there were no blood vessels tracking in the wall of the maxillary sinus. And if you look very carefully here, you'll see just a small blood vessel here. Now, it wouldn't necessarily be this high, but it's always worth identifying these structures. So in that situation, we could use any of these measuring tools. We've got a little tape measure here. Click on line. And we can see that we are, if I left click, the other way, we are, if we use a flexible measuring device, we are 9.1 millimeters approximately from the crest. Right click and delete, and that gets rid of that. I don't tend to use the tape line much, I tend to use the 2D ruler, and I come from the aspect of approximating to the crestal height and up. And so if I was making an inferior incision or cut here, I would measure approximately 7.5 millimeters, and that would give me my inferior border. Again, right click and delete. The other information that you get from this scan is bone density. You can see that this doesn't look terribly dense. And there's a little profiling button on the toolbar at the top. If you click on profile and then you make a little click from one side to the other side of the bone, you will then see a little histogram comes up, which I've just moved into play, and you'll see the outer aspect here is soft tissues, and this is low. Then you have the palatal tissue, because we're looking at the palatal first, giving you a density reading of 846. It comes down almost to the thickness of soft tissues in the mid portion, and then comes out to the buccal aspect, which is at circa 1980, 990. So what this tells you is that you would not dream of placing an implant and immediately loading in bone like this. If you're going to immediately load an implant, then you really would want a density measurement in excess of 1,000, and in the posterior maxilla, even then, restoration should be splinted, not individual. To compare these kind of readings, if you were looking at the lower mandible between the lower canines, you'd be getting readings of between 2,500 and 4,000. So it gives you some idea of how soft this bone is, and therefore you would place the implant and allow it to integrate before carrying on any restorative procedures. So we click that button and get rid of that. Right click on the profile here and delete. The other thing that you notice is you've got a maxillary septa, and they're notoriously hard to elevate the lining around. To enlarge this picture, if you just go to the little button over here which looks like a sideways arrow and click on it, it makes this image the largest image, and you can see this area is quite tricky, and this is all part and parcel of the planning. In this situation, the implant can be placed here. You've got about 5 millimeters of bone here, so in this situation, and you've got adequate width. In this situation, what I chose to do was use a Sinus technique to create a spill into the sinus into this area here, and then the implant could be placed. So cone beam CT allows us to identify structures that we might not adequately see on a two-dimensional radiograph. You want to make this image smaller, just click on the little box on the top right hand side again, and it brings us back to the beginning.